The Alacrity Center has been looking at different usability issues that prevents evidence-based psychosocial interventions from being adopted into practice or working as intended. One of the most common obstacles that has been reported is that the time required exceeds the time that's available. This occurred frequently in projects where they were adapting an existing intervention to a new setting, such as primary care, where the providers were given much less time with the recipients than was originally designed. Card sorting is the perfect activity for this type of project. Card sorting is a method that was created to help design or evaluate the information architecture of a website. But there are other applications for it, since it allows you to have a better understanding of how users perceive or group topics, which help you to categorize or prioritize your content. In a card sorting session, participants organize topics into categories that make sense to them, and they may also help you label these groups. After the participants sort the cards, the moderator should ask them to explain their logic to understand the reasoning. I like to use the program Trello for card sorting. Hi, Kendra. Thanks for talking to me this morning. Why don't you tell me about your project?
Yes, thanks so much for having me. Our project was focused on evaluating the usability and acceptability of a comprehensive self-management intervention. This intervention was initially designed for individuals with irritable bowel syndrome, or IBS. Patients with IBS experience a variety of symptoms, commonly abdominal pain, some cramping, they can have constipation or diarrhea, as well as other non-gastrointestinal symptoms, things such as fatigue or extraintestinal pain. And so we were really interested in focusing and hearing from patients about this intervention. And we focused specifically on those who had irritable bowel syndrome, as well as symptoms of anxiety and depression, as these symptoms commonly overlap. And so we recruited patients with IBS and anxiety and depression, and we also recruited healthcare providers, those who work in primary care and those who work in gastroenterology, to get their feedback on this intervention.
Why did the intervention need to be redesigned?
It had been disseminated through the publishing of a book. But we know that there's a lot more and a lot greater reach that this intervention could have. So we are really looking to be able to expand the reach of this intervention and making sure that the way we're expanding the reach and the way that we're designing it is really meeting the needs of patients and healthcare providers. And our goal would be to create a way to implement this into primary care settings.
And primary care doctors don't have a lot of time with their patients, right?
Exactly. So one of the things that we found throughout the process is that patients really valued a dual delivery mode in which the content was delivered online, perhaps through an app or a website, but that they also had check-ins with a healthcare provider to make sure that they were on track with the intervention.
So why was card sorting the right activity for your research?
So the comprehensive self-management intervention has been studied in a variety of randomized controlled trials, but it has not been implemented into clinic settings. And the intervention has a variety of components. It's pretty complex. And so we were interested in hearing from both patients as well as healthcare providers about which of the intervention components they were most interested in, which components just kind of seemed okay, and the components that they just weren't really interested in. And so card sorting allowed us to elicit feedback on these different parts of the intervention. So we were asking patients and healthcare providers which components they were most interested in or which ones they found most helpful.
And what about providers?
We asked the same questions to the healthcare providers as we did to the patients. Okay. And the healthcare providers were both those who practice in primary care as well as those who practice in gastroenterology.
You conducted card sorting remotely. How did you prepare for that?
We prepared first by learning about the different technologies that were available and that we could use to conduct card sorting. And so we ultimately decided on using Trello
Mm.
because it was fairly easy to use and it allowed patients to drag and drop the cards into different locations, which is similar to how they would do card sorting in person.
Trello is a great choice. It actually was designed to be a task management software, but I do recommend people use it for card sorting for just the reasons you said.
Yes. So we also thought through with this it was a new technology to us as well. So we thought through how can we make this easier for participants? And we did that by creating the cards ahead of time so that patients only needed to drag and drop them. We also created a glossary, which included definitions of each of the terms, which we sent out ahead of time. And then the final way that we made it easier was that instead of having each participant create their own login information, we had them use a generic study email and provided them with a password so they could just log in with the email and password and they wouldn't need to go through that cumbersome process of creating an account for something that they would probably not use again.
Smart. When we're done with this interview, I'm going to ask you to demo your card sorting so that the viewers can see what the process is like.
Yeah, absolutely.
Thanks. So, all in all, how do you think it went?
Yes, overall, it went very well. It was actually a nice way of kind of breaking up the interviews so that it wasn't just all talking, but there was an ability for participants to interact. There were a few instances where some participants had challenges dragging the cards themselves. And in those, they just told us where they wanted the cards in the category and the researchers dragged them. But other than that, most participants were able to do it. And then we were able to have good conversations about the reasons behind why they put cards in certain categories.
Yes, that's a key component, is following up and asking people why you're making certain decisions.
Yes, and that's actually a really interesting part because not all participants are able to articulate why. And so for some people, they just kind of have a sense that they like or don't like something, and others are able to explain why that is. And so I think there is an art to learning how to ask those follow-up questions.
There is, for sure. How did your findings help your redesign? What did you learn?
Yes, so the card sorting helped the redesign by prioritizing the categories that were important to patients and healthcare providers. So for instance, sleep was a module that we initially, from the research side, were thinking of either eliminating or reducing. But we actually found out that this was a really important topic to participants, the patients particularly. And so that changed our view of how we placed the sleep module and what we did with it.
How did your answers that you got from the patients as differ from the providers?
Yes, they did differ in some areas. Some areas they were similar. I would say that a lot of the social impacts, so there are questions about different modules about how IBS interferes with travel or interferes with sexual intimacy. Those were ones that about half or so of the patients thought were important, especially if those topics were relevant to their lives. Whereas a lot of the healthcare providers rated them as less important, probably due to just how patients and providers prioritize different topics.
Interesting. And what did you do with those different answers? How did you make your decisions for the redesign?
Great question. We tried to have a balance because some of the components, even if they're not people's favorite, are still really important topics to cover. And so we tried to use them in a holistic way to think about what are the essential components, and are there ways in which we can structure this so that we put topics that people are more interested in perhaps earlier in the intervention. So they're getting what they're interested in, and then we provide them with the information that we know is important, but is perhaps less interesting.
Interesting. Would you use card sorting again, and would you do anything differently if you did?
Yes, I would use it again. And I think if I were to do things differently, I would come up with some additional prompts. As I was sharing earlier, some patients had a hard time explaining why they put certain cards in certain categories. And so I would try and develop additional follow-up questions to help probe that a little bit more, to help get to the underlying reasons behind why the card was placed where it was.
That's good. That's a good tip. Do you have any other advice for somebody who might be trying card sorting for the first time?
Yeah, I would say don't be afraid to try it out, especially when you're doing things online. There will probably be things that technologies that don't work, but try and think of backup plans and just give it a try. Participants are more than willing to do it and provide feedback in this way.
Great. Well, thank you for your time.
All right, thanks, Nicole, for logging into the Trello website. What we're going to do next is we're going to talk about what strategies in the intervention that you think would be the most or the least helpful for you. To do this, we're going to do something called card sorting. And what you'll do is you'll start with that information column. And each of those blue bars represents one card. So you'll click and drag that card into the column that you think it fits best with. So something that you're really interested in, or something that you think is the most helpful, something that just seems okay, or if it's something that you don't care about or that you think would be the least helpful. So what I'll do is I'll just let you move those from the information column into those three columns. And then once you've done that, we'll just chat a little bit about what led you to put each card in each column.
Okay, great. Thank you. Let's see here. So like for this one, I have another app that already keeps track of foods. So I like that, but so is that something that I am interested in, or that I don't really care about because I already have one of those?
That's a great question. Where do you feel that it fits best as receiving information about that?
I guess I know most about that, so I'm gonna think that's least helpful. Okay, I've sorted all of the information into different categories.
Great. So we'll just chat a little bit about this, starting with the really interested in column. If you had to put the really interested in order in terms of like the top 5 things that you were most interested in, what would you say those things would be?
Well, for me, one of the things I struggle with most is traveling. So that is one that I would really, that kind of causes me the most anxiety, is around traveling. And so that one's definitely first.
Mhm.
I really like the idea. Let's see. I'm not sure whether active or passive muscle relaxation, but I'm kind of interested in that as a whole.
Mhm.
Um, I don't know much about autogenic exercises. So maybe if I knew more, I'd rate those higher. So maybe I don't want to have any false beliefs. So I'll put that one at the lowest. Like I like that, but I want to know about those, but it's not like the most interested. But then probably a comprehensive plan. So that's the order I'd put it in.
Okay, so it sounds like the travel is of most interest to you because that's something that perhaps you do a lot of and you want to understand better how to manage your symptoms.
Yeah, definitely.
Okay, and then the muscle relaxation as a whole, and then going into that plan.
hmm
Okay, we're next going to jump to that don't care about column. And we've chatted a little bit about keeping track of foods. That's a topic that you feel pretty knowledgeable about. And so that's kind of why it's of less interest to you. How about the abdominal breathing or the mini relaxation exercises? What prompted you to put those in the don't care about or least helpful column?
I think, I've had a lot of different tools that had relaxation exercises and they just don't help with any of my symptoms, I don't think. Maybe I'm not doing them right, but I just don't see myself using that as a tool. And then as far as abdominal breathing, um, yeah, I guess it's just like not something that, I'm like, oh, I want to do my abdominal breathing. I'm kind of more interested in some of these, like the muscle relaxation and, those kind of physical tools.
Yeah, sure. So it sounds like you've had some experience doing relaxation and it wasn't quite effective for you. So you're familiar with those already. All right. And then for the seems okay category, would there be any circumstances in which you would be interested in these topics?
Yeah, I guess I don't know a lot. All right, I haven't seen like how guided imagery would help. So like if that works, like I'd be willing. It seems okay, but I don't know how it works. So I'd put it in the okay category. Automatic thoughts. I work on a lot of automatic thoughts with my primary therapist already. So I don't know that I already have like a lot of tools to work with from them. Um, and then, eating every 3 to 4 hours, I already kind of do some of that, that's kind of comes from my primary doctor kind of, recommended that. So these are kind of all habits in the sleep habits too. These are kind of some things that when I originally was diagnosed, I kind of have a few of these things were kind of like the first tools that I used.
Gotcha. So these are things that you've somewhat already integrated into your life, it sounds like, or that you're familiar with.
Watch our next video, Card Sorting Part 2, to learn about conducting card sorting in person.